Hi everyone, I am Tony Marr, and today we are talking about mental health is vital. That's right. So, we go to the doctors yearly to get checkups on our physical health, but we want to say that our mental health is just as important and we should be getting checked up regularly. And access to healthcare is easier than you think, but it all starts with a conversation, talking to your doctor, talking to a friend, just to get checked up. And one of the people that has backed this whole movement all along is one of my favorite mayors out there right now, Mayor Tito Brown. So, Mr. Mayor, thank you for doing this for me today, sir.
Tony, thanks for having me, man, and thank you for that shout out. I'll
Oh,
make sure your gift cards in the mail.
perfect, perfect. Two R's in Mar, just so you know.
There
Uh,
you go.
so, Mayor, I know that Youngstown, this has been a big point of Youngstown, the city of Youngstown, especially during COVID. But why is mental health important to discuss and talk about openly?
Well, Tony, I think the one thing you have to know about mental health that's important to talk about is individuals need to recognize that what mental health is. Most what health, where medical, if you have a medical issue, you know what that looks like, you know what that sounds like. Some people may not know or able to recognize what the mental health issue is. They may feel a certain way, they may think a certain way, and they're not sure what that is. And it's mental health. And we all have a certain level of mental health that we have to deal with, or mental health issues that we have to deal with.
Yeah, and especially now, I mean, mental health is more prominent than ever. So how can we all play a part in, say, addressing the stigma of mental illness? So, the stigma is you might have it, but you don't talk about it. So how can we address that?
I think it's critical for people like myself, or those who may have come in contact with someone, to share their story. I think a lot of times if we share our story about, the problem is people have a stigma. If you're mental health, you're crazy. That's not the case. We all have a sense of a level of comfort of how far a mind can stretch to deal with certain situations. But I think if people realize and recognize that it is not a stigma that we should, run away from, I think we'll be much better as a community if we would take it and say, you know what, I had to talk to somebody because I was feeling a certain way, or I just went through a stressful part of my life. I just literally just got off the phone with a young man who's grieving the loss of his baby mother of four. So he's grieving. He's running through the process. He's going through the grief process. But all he wanted to do was to let me listen, and I think that's important for us to listen, but also to share and tell our story personally. For us, for me to talk about, I grew up with a father who was, a double. He was a double addict. He was had mental health issues, and then he was on drugs. So a double diagnosis, what they call dual diagnosis. So it's critical for us to recognize what those things and how those things affect our life.
Yeah, and like you said, it's personal for you, and it's recognizing that, and it's a lot more common than people really think about. I think some of the statistics are 1 in 5 people. I mean, that when you put that on paper, that's a lot of people. So friends, families, everyone I mean, it's
Yeah.
definitely in there.
Well,
Um,
if you look at a household of five, I have a household of five, and so 1 out of 5, if it's in your household, or 1 out of 5 in the population, those are people that you're going to come across somebody at a grocery store, a gas station, at work, at church, at school. You're going to come across someone who's dealing with those mental health issues in their life.
right. And for the city of Youngstown, I mean, how has your administration started to address mental illness, or what kind of approaches is the community taking?
I mean, there's several approaches that we've taken. I know, Tony, I listen to our police scanner, and I hear the calls. Many of those calls are not police calls, but they're mental health calls. But we don't have a mental health police out there that we can send, say, no, let's let the police go take care of that. So we deal with it. Our officers are trained in crisis intervention. And I think we're learning more that the officers learn who some of the individuals are. They even know what some of their triggers are. I can tell you a story that I heard. The officers called. They called out to a home. Another officer chimed in and said, "No, don't go there. I'm going to call his brother. His brother can calm him down, and then we can go get him some help." So, and for me, that let me know that the officers are learning how to deal with that. But many of the calls, if we need to figure out how to do the follow up from that call we get today about someone who's not feeling well or having an issue, we need to figure out what to do tomorrow that makes sure that we get a counselor or someone involved in their life if they don't have someone involved in their life, because there's a trigger point or something happened that changed their dynamic of their day.
And that's a huge step. I mean, that's kind of like the first step in going towards a mentally healthier community, but also a trauma-informed community. A lot of this comes from trauma that they might have experienced in the past.
Yeah.
And Youngstown, it is predominantly African American, and there's always that stigma in the African American community when it comes to mental health that they don't want to talk about it. People don't want to talk about it, but also the access of care. So I mean, are there any programs in Youngstown that set up to make getting that access of care a lot easier?
Well, I think there are. I think just in partnerships that we're dealing with, those who are really in partnership, mental health has become a constant component, and I'm not sure that's always been the case. And we talk about trauma, and we look at Youngstown and the reality that many individuals, there's gun violence. Someone may have been a victim of gun violence, tragically, or maybe crippled from that, or the family's dealing with now their mental state after the gun violence. We've recently started getting an advocacy group together. From when you get to the hospital, you want to figure out what's happening. Getting an advocate to walk with the family through this entire process to help them deal with this. So it's a new piece for us, and it came out of actually a difficult situation. A mother got there; she wanted to see her son. He was a victim of a homicide, and she could not see him. They wouldn't let her see the child, and but the security at the police, Mercy and the hospital had their policy. So we've come up with an advocate that can talk and advocate for those from start to finish. And now that family is dealing with the mental health counselor right now to help them through those days after the funeral and after everything changes and settles down for them.
Yeah, it's definitely a change. And I mean, I think that part too, along with the education about mental health, it goes a long way, especially in the community.
Yeah.
Sorry, go ahead.
I say it is the educational piece. I can just tell you from being the mayor at City Hall, we see too often many individuals that come and walk through downtown Youngstown. Some are just pleasant and some are not. And I've had situations where some who are not pleasant, I've had to intervene and kind of educate the public, the individual who they were talking with, and they had no idea what they're talking about. And I explained to them that they have some mental issues that they're dealing with in their life right now, and I told them it's not personal. They don't even know you. It's just what their mind is telling them right now. And the gentleman was grateful that that could have gone a different way, but for me to be educated and be aware of those who are the population that we're dealing with in our community, I think that was a prevention. I think the more that we can educate the public, that it's not always let's react to what someone says or react to how someone acts in front of us. Their actions may not be their own. I mean, you may see them 3 days later and they may not recognize you, or their behavior is totally different if they've been able to seek in treatment.
And that's huge, especially, from you, that's leadership in the community about getting, the education out there and understanding a large part of the community. So for you, what messages would you like to get out there to give to the community to help reinforce the message that mental health is vital?
Well, I'll first say Tony, that is real. It is a true thing. It is something that we all have to deal with at some point in our life, in our daily life, in our public life, and our private life. We're all going to have to deal with the mental capacity, and you could probably take your own personal experience, my personal experience, that we have to deal with it. For African American, and more specifically African American men, we it's a stigma of being weak. If you have to see a therapist, or you're not capable of handling things on your own. But I think we have to break that cycle. And I talk to my kids, and I have 2 girls and 2 boys, and I tell them, let's talk about it. Let me tell me how you're feeling. If you don't feel this way, and I can be empathetic to how you're feeling. I don't want to say, well, you can't act like that, you can't think like that. but that's your mind, and you should be able to, express that. But also, I always tell them there's not one thing you can solve by yourself that we can't solve together. So that's how I think it is about mental health. There's not the one thing that one person can't solve. It's all of us can help them, but we just got to make sure they know it's available. They know that we're here to help, but remove it, making sure that it's not a stigma or they're going to be, cast out into the sea or, put on an island. We're all here for them, and we need to make sure that there's a welcoming community. And I think that's where we're getting to. The more and more, it's my third year as mayor, I hear our partners talk about mental health access and mental health capability. So I think that's one of those things that in everything that I do and all my priorities and all my planning, that I want to make sure we talk about a vibrant neighborhood and a vibrant community, that we make sure that access to mental health and access to medical health is there as well.
Perfect. And sir, they always say great leaders lead by example, and you are definitely exemplifying that. So thank you for coming on today and talking about mental health is vital. And if anyone has any questions, you could please check out mhisvital.com. There's a lot of resources on there. There's a quick mental health checkup. Maybe you're experiencing some of these symptoms. There's definitely some information on there and lots of resources to care. So please check that out. And again, Mayor Brown, thank you so much for coming on today.
Tony, thanks for having me. Thanks for making sure this topic is heard by all.
You got it. Have a good day, everyone.